My name is Dawn Marapodi. I am a physical therapist and I specialize in oncology rehab, and I am a certified lymphedema therapist. Today's video's goal is to educate you on lymphedema. Lymphedema is swelling that can occur after cancer treatments. It is different than swelling that occurs postoperatively because it is protein-rich lymph fluid. The lymphatic system is a specialized system of lymph vessels and nodes that help to remove excess fluid, proteins, and damaged cells from our tissue space. The volume of fluid that our lymphatic system has to manage is variable and can fluctuate based on diet, weather, physical activity, injury, or infection. When the lymph nodes and vessels are damaged due to surgery or radiation, the system works less efficiently, which can lead to swelling. This swelling may occur in the arm, hand, breast, or chest wall. Because the lymph nodes do not grow back after surgery, the risk for lymphedema is long-term. Not all patients will develop swelling, and some will develop swelling many years after their treatment. Overall, 80 to 90% of women who do develop lymphedema will develop it within the first 3 years, but the remaining 10 to 20% can develop it later. The statistics on developing lymphedema after treatment for cancer are variable. If you had a sentinel lymph node biopsy with only a few lymph nodes removed, the incidence of lymphedema is between 0 and 3%, but it can increase with radiation. If you had an axillary lymph node dissection with more than 10 lymph nodes removed, the risk is around 30%. It can go as high as 60% with an axillary lymph node dissection combined with radiation. The onset of lymphedema is gradual and sometimes will present as a feeling of heaviness or achiness in the arm or chest prior to swelling being visible. Imagine a 5-lane highway that is reduced to 3 lanes. As long as traffic stays at its regular level, cars will slow down, but eventually they will get through. This is similar to how your lymphatic system functions after treatment. The fluid is managed, but more slowly than before. If you took the same highway at rush hour, you might find that traffic is backing up with longer delays. This may represent a change in fluid where you may start to notice symptoms like heaviness, achiness, or fullness, or some visible edema. These symptoms may initially come and go, and you may notice this after events that cause the body to release increased fluid to the tissues. For example, adjuvant radiation, exercise during hot conditions, having an excessively salty meal, or sitting in a hot tub. If you took the same highway with an accident at the merge, you will notice a more significant immediate backup. This may represent the swelling that occurs with injury or infection. The number one risk factor for lymphedema is infection, and we stress infection prevention techniques to all of our patients. However, there are other risk reduction guidelines that can be followed to help lower the overall risk of lymphedema. These recommendations include avoiding trauma to the extremity, including blood pressure checks, IVs and blood draws, wearing gloves when doing activities that may cause trauma to the skin, using moisturizer to prevent chapping and chafing of the skin, and taking breaks during repetitive activities or heavy lifting. Regular exercise and a healthy diet are important to maintain your weight within normal range and can also help to reduce the risk for lymphedema. If you exercised regularly prior to surgery, it is important to ease back into your exercise routine by slowly increasing weights and repetitions to avoid injury or swelling. If you have not previously exercised, walking and your post-op exercise program are a good place to start. If you notice that your exercise routine is routinely causing a feeling of heaviness, fullness, or swelling, you may need to decrease the intensity of your exercise or get fitted for a compression sleeve to wear during those activities. Because lymphedema is progressive and can worsen over time, it is important to seek intervention when you experience symptoms of any kind from a certified lymphedema therapist. Response to therapy is always better with early intervention. We hope this video has been helpful, and if you need a referral to the lymphedema clinic, please speak to your physician.